So dear students, today we would learn about introduction to cardiovascular system. So in today's session, the competencies are to define cardiovascular system and components and functions of cardiovascular system. And we would learn about the various types of circulation, structure of heart and its position within the thorax, means basic structure of heart where we are going to see the chambers and all. And we would also describe the structure and functions of arteries, veins, capillaries, explain the relationship between different types of blood vessels, differences between the arteries and veins and capillaries and sinusoids. And we would also discuss the arteriovenous anastomosis and its functional significance, and what are end arteries with examples. So these are the learning objectives of today's session. Let's begin with the introduction to circulatory system. So the circulatory system is also called as cardiovascular system. It is a vital organ system that delivers essential substances to all the cells for basic functions to occur. The system supplies nutrients to various tissues and removes the waste products from various tissues of the body. The cardiovascular system is a network of composed of heart and also the it is a centralized pump. The heart is the centralized pump, and blood vessels that distribute the blood throughout the body, and blood serves as a medium of transportation and blood to the different substances. So that is about the basic idea of cardiovascular system. Let's talk about some components of it. The heart is the important component. The heart pumps the blood and provides the major force that causes the blood to circulate, whereas the blood vessels carry the blood to all the tissues of the body and back to the heart. So in addition, the blood vessels which participate in the regulation of blood pressure, the vessel which carry the blood away from the heart are called as arteries, whereas the vessels which carry back the blood to the heart are called as veins. So the functions of cardiovascular system are transport of gases, nutrients, electrolytes, waste, hormones. The blood can also serve to the transport disease causing bacteria, viruses and other toxins. However, drugs given to treat the diseases are also transported through the same blood. So let's talk about the heart. Heart is a muscular pump that is which is the central component of circulatory system. It is the chief component of circulatory system. It is divided into right and left sides by a muscular septum. Human heart has got 4 chambers. So it is a 4-chambered hollow muscular organ and roughly of the size of a clenched fist. And it is situated in the thoracic cavity between the lungs. The muscular component of the heart, that is the myocardium, is composed of involuntary cardiac muscle. So the muscle of the heart is made up of a specialized muscle confined only to the heart called as cardiac muscle, which is an involuntary muscle. It is lined by a membrane called the endocardium. So internally the heart is lined by the endocardium and externally it is lined by external epicardium. So heart has got 3 layers. Outer epicardium, which is nothing but the visceral layer of the pericardium. Then the muscle of the heart, which is called as cardiac muscle, and internally it is lined by the endocardium. So cardiac muscle forms myocardium. So endocardium, myocardium and epicardium are the 3 layers of heart. Contraction of the cardiac muscle cells is stimulated by electrical impulses that are periodically fired from the regulatory centers of the heart. The SA node in the roof of the right atrium and AV node. SA node is sinoatrial node, which is present in the roof of the right atrium, and the AV node. AV node is atrioventricular node, which is present in the septum between the atria and the ventricles. The SA node is widely regarded as the natural pacemaker of the heart. Means the contraction of the heart is initiated at the SA node. So SA node is considered as the natural pacemaker of the heart. Let's talk about the blood vessels. The blood vessels form a closed system of tubes. So they are the tubes which carry the blood. So that carry the blood away from the heart to the tissues of the body and then return back to the heart. The blood vessels includes arteries, capillaries and veins. So the arteries. Here in this image we can see an arteries and veins. The red colored structure is an artery, whereas the blue colored structure is the vein. Arteries. They are the thick walled tubes that carry the blood away from the heart. Means they are the distributing channels. The blood leaving the heart passes through the vessels of progressively smaller diameter referred to as smaller arteries and arterioles. Finally, these arteries will divide to form a thin-walled vessels called as capillaries. Capillaries are microscopic vessels that connect arterioles and venules. So here in this image, the pink one, these are the arteries which carry the blood from the heart to the various tissues. The arteries divide to form the arterioles, which are the smaller arteries, and arterioles divide to form a microscopic vessels that connect the arterioles and venules called as capillaries. And these capillaries join to form venules first and venules join to form veins. Veins carry the blood back to the heart. So arteries are like distributing channels. Veins are draining channels. So they drain the blood to the heart. So they are thin walled tubes that carry the blood from the tissues of different parts of the body back to the heart. So the blood returning to the heart from the capillaries passes through the vessels progressively larger diameter. Means the smaller diameter venules join to form smaller veins, and smaller veins they join to form large diameter veins, which are called like large sized veins. Except for the capillaries and the venules, if you see the wall of the blood vessel, it contains three layers. It consists of three layers. The three layers are tunica intima. The innermost layer is the tunica intima. The middle layer is the tunica media. And the outermost layer is the tunica adventitia. So tunica means a covering. So tunica intima, innermost. Then middle, the thickest layer is the tunica media, which you can see thicker in the arteries. And the outermost is the tunica adventitia. So this is tunica intima, tunica media, tunica adventitia. Let's see the features of arteries. Characteristic features of the arteries. They are thick walled vessels and carry the blood from the heart to the capillaries. Their lumen is smaller than the veins. So their lumen is smaller than that of accompanying veins. They do not have valves in their lumen. So there are no valves in the artery. They divide repeatedly like a branching of a tree and they gradually become smaller in size. So as they divide, the arteries reduce in their diameter. They are often accompanied by veins and nerves which form together a bundle called as neurovascular bundle. So neurovascular bundle contains usually arteries, veins and nerves supplying a particular region. So functionally, let's divide these blood vessels. So functionally, we can classify the blood vessels into 5 groups. The first variety is the conducting vessels, where the large arteries are conducting vessels, distributing vessels, medium-sized and small-sized arteries considered as distributing vessels, and resistance vessels. where the arterioles are considered as resisting vessels. Exchange vessels, capillaries, where exchange of material happens, which are the capillaries. Sinusoids and postcapillary venules are exchange vessels. Capacitance or reservoir vessels, large venules and veins, and these are the low pressure, large volume vessels. The high capacitance of these vessels is due to the fact that they are the thin walled and have the capacity to dilate. So these are the 5 types of blood vessels where we divide them as functionally. Functionally, arteries can be classified into 3 types. So we classified the blood vessels altogether. Now we are going to classify arteries based on its function. So functionally, the arteries are classified into elastic arteries, which are the conducting arteries, which are large sized arteries, where the tunica media of the elastic artery contains mainly of elastic tissue, elastic fibers. That is the reason they are called as elastic arteries. The second variety is the muscular or distributing arteries. Distributing arteries are called muscular because the tunica media contains mainly of muscle, smooth muscle component. So that is the reason they are called muscular arteries. They are medium sized arteries. And the third type of arteries are arterioles. Arterioles are considered as resistant vessels. They are of having very small diameter. So talking about these elastic arteries first, elastic arteries are otherwise called as conducting vessels, are large arteries arising from the heart, and means they are mainly seen near the heart, and their main branches like aorta. Aorta divides into brachiocephalic trunk, common carotid artery and subclavian artery. So these are the examples of elastic artery. They are called elastic arteries because tunica media of these arteries is predominantly made up of elastic fibers. They are also called as conducting vessels as their main function is to conduct the blood from the heart to the muscular arteries. That is the reason they are called as conducting vessels. Next about the muscular arteries. Muscular arteries, as I said, it is a medium sized. They are medium sized arteries. They are also called distributing vessels, and these medium sized arteries supplying individual organs and various parts of the limbs. So example of the muscular arteries are the renal arteries, which are near the kidneys, testicular arteries, which are the arteries supplying the testes, or uterine artery supplying the uterus, radial artery which we feel the radial pulse in the forearm. So all these arteries are considered as medium sized arteries. They are also called as distributing vessels because there is a gradual change from the elastic to the muscular arteries. The elastic material decreases. So tunica media contains elastic tissue in elastic vessels, and it reduces and it is replaced by the muscular tissue. So the smooth muscle tissue becomes main component, main constituent of tunica media, that is approximately around 75%. And these arteries regulate the flow of blood to an organ or the part. So as the smooth muscle of the tunica media can alter the size of the lumen by contraction and relaxation. So that is about the muscular arteries. The third type of arteries are arterioles. Arterioles are the smallest division of the muscular artery with 100 mm or less than 100 mm of diameter, and the narrow lumen is surrounded by abundant muscle tissue, and they are main source of peripheral resistance to the blood flow. That is the reason they are called resistance blood vessels. So hence they are considered as resistant vessels, and they play an important role in regulating the diastolic blood pressure. So as the arterioles progressively divide into smaller branches, their walls become thinner and form successively terminal arterioles and meta-arterioles. So that is about the arteries. So the clinical aspect of these arteries, it is called atherosclerosis. That is a condition where we see a patchy accumulation of fat or lipid, so or fibrous tissue and macrophages. So internally, the blood vessel we see inside the tunica intima. Internally, it is lined by the patchy accumulation of the fat, fibrous tissue and macrophages. So this accumulation is called as atheroma accumulate, which is present in the tunica intima and which makes the luminal surface of the artery uneven, and that can initiate the formation of a blood clot. So blood clot inside a blood vessel is called as thrombus. So it initiates the formation of thrombus which may occlude the lumen. So example is, if it occurs in the coronary artery, it may lead to heart attack, means myocardial infarction, means the part of the heart which is supplied by the blood vessel undergo necrosis and leading to cell death, which is called as myocardial infarction. In lay term, we say it as heart attack. The other condition is arteriosclerosis. Arteriosclerosis is hardening of the arteries. It is an age-related progressive generalized degenerative disorder of arterial walls and usually seen after the middle age, and there are generally a slow loss of the elasticity and thickening of tunica intima due to the increase in collagen and accumulation of the lipid. So subsequently it leads to diffuse narrowing of the lumen of the blood vessels. So elastic tissue is reduced in chronic smokers, resulting claudication in the lower limb. So that is about arteriosclerosis. Arteriosclerosis, in simple terms to say, it is the hardening of the tissue where tunica media gets hardened there. Instead of muscle or elastic tissue, it becomes hardened. So this condition is more common in chronic smokers because the elastic tissue reduces in chronic smokers and results in claudication in the lower limb. So what is this claudication? Claudication is the pain caused by too little blood flow to your legs. So because of reduced blood flow to the limbs, to the legs and the arms, it results in a painful condition called as claudication. This is usually a symptom of peripheral artery disease in which the arteries that supply the blood to the limbs are narrowed because of arteriosclerosis. So that is about the arteries. So we learnt classification of the arteries, how to classify and varieties of arteries, and we also saw little clinical correlation. Next, let us talk about veins now. The characteristics of veins. Veins are thin-walled vessels that carry the blood from the capillaries to the heart. So structurally, if you see the veins, they do have 3 layers similar to arteries. Tunica intima, tunica media, and the outermost is tunica adventitia. So in cross section you can see the 3 layers: tunica intima, tunica media, tunica adventitia. So the tunica adventitia is the thickest layer among the 3 layers. Tunica media consists of muscle, but it is comparatively thin compared to tunica adventitia. So structurally the veins have 3 layers similar to arteries, but the thickness of the layer varies, whereas in the arteries we saw the tunica media is the thickest layer, and in the veins tunica adventitia is the thickest layer. So the veins are the capacitance vessels. So we can group the veins as capacitance vessels because they return the varying quantities of venous blood towards the heart and have the capacity to distend or collapse. So if there is no blood, the veins are collapsed, and during venous return, the veins get dilated. So based upon the quantity of blood, the diameter of veins change. So the large veins are formed by the union of smaller veins called as tributaries. So for the veins we say tributaries, for arteries we say branches. So all the tributaries join to form a larger vein, just like a river, and they have larger lumen. So the large veins will have larger lumen compared to the arteries. The arteries are thick walled and have smaller lumen, and the lumen inside the veins are quite large. So you can see here. And the amount of muscle and the elastic tissue in their walls is less compared to that of arteries. So you can see the tunica media is thinner compared to that of arteries. Their lumen is often provided with valves. So we see valves inside the veins, whereas the arteries are devoid of valves. There are no valves in the arteries. So their lumen is often provided with valves which prevent the reflux of blood and thus maintaining urine directional flow of blood even against gravity. So here we can see the valves. So once the blood moves upwards, we can see the valves approximate with each other, closing it. So preventing regurgitation of blood flow. So allowing only unidirectional flow of blood. So let's classify these veins. The veins are classified into three types: large, medium and small. Large sized veins, medium sized and small sized. First, about the large veins, we see all three layers in the large veins: tunica intima, tunica media, tunica adventitia are well differentiated. So the tunica adventitia is always thicker than tunica media. The walls of the large veins have some elastic tissue that resists the pressure of the right atrial systole. So large veins which drain the blood into the heart, so they are near the heart. Inferior vena cava and superior vena cava are the examples of large sized veins. Next, about the medium sized veins, these veins also have all three layers in their wall like tunica intima, media and adventitia, and here also the adventitia is thicker. And example of medium sized veins are splenic veins, testicular veins and even the veins in the limbs are the examples of medium sized veins. Small veins or venules. These veins again we can divide into two types: post-capillary venules and muscular venules. So first, about these post-capillary venules, they are the smallest veins and receive blood from the capillaries. Their wall is made up of endothelium. So internally they are lined by simple squamous epithelium which is called as endothelium. These veins have special permeability, means they allow few substances into through the wall into the vessel. So the diffusion of the fluid and white blood cells into the surrounding tissue and absorption of intracellular fluid from the tissue into the venules. So that is about post-capillary venules. Next, muscular venules. They are so called because of their presence of one or two layers of smooth muscle cells outside the endothelium. That is the reason they are called as muscular venules. Okay, let's talk about the blood supply of these arteries and veins. Of course, there is a blood inside these arteries and veins. The blood inside the lumen, it is not enough to supply the whole thickness of large arteries and veins because larger arteries and veins are quite thicker. So the periphery, the outer part of the arteries cannot be supplied by the blood inside the lumen. It cannot provide the complete nutrition. So the outer part, it is supplied by a separate blood vessel which enters into the tunica adventitia. So we know the outer layer is called tunica adventitia. So blood vessel, supplying a blood vessel is called as vasa vasorum. So the term is called as vasa vasorum. That is about the larger arteries, and larger veins also. Whereas the smaller arteries and veins get nutrition from the blood present in the lumen itself. So they doesn't need any extra blood supply. And nerves supplying these blood vessels is called as vasa nervorum. We see the blood vessels, they undergo vasoconstriction and vasodilatation, which is because of sympathetic and parasympathetic supply, which is called as vasa nervorum. Venous valves. So we will talk little more in detail about these venous valves. We know veins contain valves. So the inner lining of the most of medium and small sized veins are thrown into a folds. So at particular intervals, they are thrown into a delicate semilunar folds which are called as valves. So these are delicate semilunar folds of the endothelium, which are called as venous valves. And venous valves are usually two cusps. You can see one right and one left. So they are bicuspid. Two valves are present. So venous valves are bicuspid and consists of two valves, and the valves are most numerous in the veins of the lower limbs, especially because they have to do the venous return against the gravity. So the venous return in the lower limb is against the gravity and preventing regurgitation of the blood back into the lower limbs. So it provides unidirectional blood flow. So let's talk about clinical correlation associated with these venous valves called as varicose veins. So the accumulation of blood in the veins of the legs over a long period of time may occur in the people whose profession requires standing still all the day, especially watchmen or people who stand for a long time like a waiter near the hotels. So all these people stand, even teachers stand for a long time while teaching. So the professions where we see standing still all the day can cause veins to stretch at a point, and where the venous valves are no longer efficient, so they become incompetent. And consequently, due to the backflow of the blood, the superficial veins become dilated and tortuous, and this condition is called as varicosity of veins. The great saphenous vein in the lower limb is most commonly affected due to varicosity. So that is about varicose veins. So moving on to capillaries. So we have finished with the arteries and veins. Now we start learning about capillaries. The flow of blood through the capillaries is called as microcirculation because they are thin walled and they are quite thinner in their thickness. So the capillaries are thin walled and endothelium lined thin microscopic vessels. They connect the arterioles and venules. So the walls or capillaries are made up of only one cell layer of simple squamous epithelium. So one cell layer of the squamous epithelium, which is called as endothelium. There are over 40 billion capillaries in the body with extensive network of vessels almost in every tissue of the body. So the average diameter of the capillary is 6 to 8 mm, as the diameter of erythrocyte is about 7 mm. So if you see erythrocyte means RBC, red blood cell. So the diameter of an RBC is 7 mm. So the capillary diameter is 6 to 8 mm. So it is almost the size of an RBC. So the RBCs or the erythrocyte, they pass like one behind the other. So one at a time alone they pass through the capillaries. So if you talk about the different types of capillaries, capillaries are of two varieties: continuous capillaries and fenestrated capillaries. Continuous capillaries. The endothelial cells form a continuous tube. The cells are held together by tight junctions. So such capillaries are continuous, means there is no gap between the cells. The cells are held together by tight junctions. So continuous capillaries are found in skin, muscle, lung and brain. Let's talk about fenestrated capillaries. Fenestrated capillaries are characterized by the wide pores between the endothelial cells. So between the cells there are pores. These pores are closed by a layer of mucoprotein. So fenestrated capillaries are found in pancreas, endocrine glands, intestinal villi, where exchange of materials are more happen at fenestrated capillaries. Next about sinusoids. Sinusoids are large irregular vascular spaces which connect arteriole with venule or venule with venule. So those are the sinusoids, which are large irregular vascular spaces. And these sinusoids replace capillaries in certain organs such as liver, spleen, bone marrow, suprarenal glands, parathyroid glands, etc. So the lumen of the sinusoid is irregular and wide, about 30 to 40 mm in diameter. The walls of the sinusoid are thin and made up of endothelial cells with large pores or slits. Due to irregular lumen, the flow of blood is sluggish in the sinusoids that allow sufficient time for exchange of substances between blood and the tissue fluid. So this is how we completed different types of blood vessels. Okay, let's move on to types of circulations. So we have finished with the arteries, veins, capillaries, sinusoids. Now let's see how these blood vessels connect with each other. The circulatory system is divided into two separate loops. One is the shorter pulmonary circuit and the longer systemic circuit. So the shorter pulmonary circuit that exchanges blood between the heart and the lungs. So it is between the heart So this is the heart here and image, and we can see the distribution to the lungs. So that is a shorter pulmonary circuit. The longer systemic circuit that distributes the blood throughout all other systems and tissues of the body. So all other systems. So it is between the heart and all other systems. So that is called as systemic circuit. So let's talk about this pulmonary circuit or pulmonary circulation. So the deoxygenated blood entering the right atrium of the heart. So the right atrium is the collecting chamber of the heart. So we know the heart is divided into 4 chambers. Right atrium, right ventricle, left atrium, left ventricle. So the right atrium is the collecting chamber of the heart. So this is the collecting chamber of the heart where it receives the deoxygenated blood from various organs of the body. So they takes up the deoxygenated blood, and from the right atrium the blood enters into the right ventricle. So we can see the direction here. From the right atrium the blood enters into the right ventricle. From the right ventricle we can see the origin of pulmonary trunk. So pulmonary trunk branches to form pulmonary arteries, and finally it forms capillaries. So these are the arteries, pulmonary arteries, which finally divides to form capillaries. Capillaries are present in the lungs. So where the deoxygenated blood enters and becomes oxygenated in the alveoli of the lungs, and then through the pulmonary veins it returns to the left atrium. So these are the pulmonary veins which carry the oxygenated blood. That is why it is shown in pink color. Pulmonary veins. Here are the pulmonary arteries. So pulmonary veins carry the blood towards the left atrium of the heart. finally reaches the left atrium of the heart. So the now blood has reached the left atrium of the heart. So from the left atrium, the oxygenated blood enters into the left ventricle. So we can see here the direction. It enters into the left ventricle. From the left ventricle, we see the origin of aorta. So the aorta will divide to form medium-sized arteries, and finally they reach different tissues in the body, completing systemic circulation. So the systemic circulation begins from the left ventricle. So from the left ventricle, the oxygenated blood from the left atrium passes to the left ventricle, which pumps through the aorta, and it branches to the capillaries to the rest of the body. So we can see here capillaries of systemic circulation, and capillaries joins to form veins, and which become increasingly larger in diameter, and finally they form superior and inferior vena cava, which return the deoxygenated blood to the right atrium of the heart through superior and inferior vena cava. Superior vena cava and inferior vena cava to the right atrium of the heart. So this completes the systemic circulation. So the right atrium receives the same amount of deoxygenated blood which was pumped from the left ventricle at the same rate. So the normal flow of blood, artery to the arterioles, arterioles divide to form capillaries, and capillaries joins to form venules, venules joins to form veins. So that is about pulmonary and systemic circulation. Let's talk about the third type of circulation, portal circulation. Portal circulation is in fact a part of systemic circulation. So it is a part of systemic circulation. The only difference is it begins with the capillaries and ends with the capillaries. Means in the portal circulation we see two sets of capillaries. So here in this image we can see the portal circulation in the liver, where we see the two sets of capillaries. This is the first set, this is the second set. So the blood passes through the two sets of capillaries before draining into systemic circulation. So here is the inferior vena cava, which is a part of systemic circulation. The portal vessels are the vessels which connect the two sets of capillaries at their two ends. Thus the capillaries through two sets of capillaries before return to the heart. So in between, this is the portal vessel. We can say it is portal vein, which is formed between two sets of capillaries. So here we can see the two sets of capillaries before the venous blood returns to the heart. So that is about. So talking about hepatic portal system, the blood supplying the abdominal organs passes through the two sets of capillaries before it returns to inferior vena cava, that is venous blood. From the capillary bed of gastrointestinal tract, spleen and pancreas, the portal vein forms, and this portal vein enters into the liver, and in the liver, that is inside the liver, it passes through a secondary set of capillary bed. So this is the first set of capillary bed, this is the secondary set of capillary bed which is present in the inside the liver. Finally, the blood drains into inferior vena cava. So in this way, the blood with high concentration of nutrients absorbed from the intestine, stomach, and goes to the liver, and first where certain modifications takes place before it supplies to the other parts of the body. Means whatever the nutrients which is absorbed in the small intestine, they pass through this portal vein, and the portal vein divide to form capillaries inside the liver, where most of the biochemical changes, that is the glycolysis, all the fat metabolism, all the metabolisms of different substances happens in the liver, and some substances are stored in the liver and some are given to the blood. And after doing these modifications, the blood enters back into the inferior vena cava. So that is about this hepatic portal system. Hepatic portal system is essentially concerned with the transport of absorbed nutrient from the food to the liver and their subsequent metabolism. We can see the portal circulation even with the pituitary gland or hypophyseal gland. So the portal circulation also connects the median eminence and the infundibulum of hypothalamus with the pituitary gland or adenohypophysis. Hypothalamus, median eminence of hypothalamus. So adenohypophysis, which is called as anterior pituitary. This is the anterior pituitary. Posterior pituitary. So the adenohypophysis connection, here we can see the portal vessel. So hypothalamo-hypophyseal portal circulation. Hypophyseal means pituitary gland. So adenohypophysis and thalamus. So it is called as hypothalamo-hypophyseal portal circulation. So these are the two examples of portal circulations in our body. So now we completed with the types of circulation. Let's move on to the anastomosis. Anastomosis means it is the communication between the blood vessels which forms a collateral channel. So the communication between the blood vessels which forms a collateral channel is called as anastomosis. Anastomosis can be arterial anastomosis, means the anastomosis between the arteries. Venous anastomosis means the collateral circulation between the two veins. And arteriovenous anastomosis means the communication between the arteries and veins are called as arteriovenous anastomosis. So talking about the arterial anastomosis and its types, a direct arterial anastomosis. Here in direct anastomosis, where it occurs between the two arteries. So the two arteries are joined directly with each other. So for example, radial and ulnar arteries. So the radial and ulnar arteries are present in the forearm. They are connected in the palm by means of palmar arches. So that is an example of direct anastomosis. Next anastomosis under arterial thing is the convergence anastomosis. Convergence anastomosis occur where the two arteries unite to form a single artery. For example, vertebral arteries. So the right and left vertebral arteries which are present in the neck, they enter inside the cranium through foramen magnum and they join inside the cranium to form a single artery called as basilar artery. Basilar artery further divides to supply the posterior side of brain. So that is about convergence anastomosis. Next about the transverse anastomosis. Transverse anastomosis is where a small artery connects two large arteries. Is an example of transverse anastomosis. For example, inside the brain there is a anastomosis between the blood vessels supplying the base of the brain called as circle of Willis. In that anterior communicating artery connecting right and left anterior cerebral arteries, it is an example of transverse anastomosis. Potential anastomosis. Potential anastomosis takes place between the terminal arterioles. So in such a type of anastomosis, collateral circulation cannot take place if one of the arteries suddenly blocked. So potential anastomosis, it is to say they are having communication, but those communications are quite thinner in normal. So if there is a sudden blockage of the artery, so it cannot take up collateral circulation immediately. So if sufficient time is given, if the blocking of an artery is quite slower, so the arterioles can dilate and establish a collateral circulation. So example of such anastomosis is the coronary arteries. So coronary arteries are the examples of potential anastomosis. Coronary arteries are the arteries which supply the heart. Next about the arteriovenous anastomosis, which are called as the shunts. are the direct connection between the small arteries and small veins, and these occur in the regions such as skin of the nose, lips, ears, and in the mucosa of alimentary canal, nasal and oral cavities. So those are the areas where we see arteriovenal anastomosis. So the last type of anastomosis is the portocaval anastomosis, which occurs where there is a connection between the systemic veins and portal veins. So there is a connection between the systemic circulation and portal system of veins, and these occur at venous plexus such as around the esophagus. So around the venous plexus around the esophagus, venous plexus around the umbilicus and the rectum are the examples of portocaval anastomosis. So let's talk about the end arteries. These are the arteries whose branches do not anastomose. So till now we were talking about the communication between the vessels, and the blood vessels which doesn't have any communication are regarded as end arteries. So these are the arteries which whose branches do not anastomose with the branches of other adjacent arteries. So the example of these arteries, here we can see the arteries which supply the intestine are the examples of end arteries, and central artery of retina, arteries of spleen, liver, kidney, metaphysis of the long bones, central medullary branches of cerebral arteries. So all these arteries are the examples of end arteries. If these arteries are blocked, the area supplied suffers from ischemia that may lead to cell necrosis, that is cell death. So functional end arteries means they have some communication but they are not active all the time. For example, are not actual anatomical end arteries. They have communications. So because this anastomose at the levels of arterioles very thin. So these anastomosis is potential anastomosis which we just now discussed in coronary arteries. But if they are blocked, the tissues supplied them become ischemic. Example, coronary arteries and cortical branches of cerebral arteries. So this is how we explained about the end arteries. So that's how we completed the introduction to cardiovascular system. I hope you understood this topic. Thank you.